we think of the reproductive system and think, well, I'm not thinking of reproducing. I'm done with that. Or I'm not there yet. Or really? But for me, it hit me when I was in the ashram 6 years ago, when I noticed that a lot of the poses affected the reproductive system for the better. And I asked to say, why is it that the reproductive system is so affected by all these poses? And the answer I given was that the reproductive system is really a reflection of our overall health. So if our overall health goes down, then we are going to have issues with our reproductive system. In case we're meeting for the very first time, my name is Yoga Sensei Towani Clarke, and I started Kututa Yoga 11 years ago, and I've been teaching yoga for 11 years. And one of the people that I had the great fortune to teach is our guest today on the program, Dr. Mumba Chalwe, and she is Zambia's first Zambian female urologist.
I'm happy to be here.
Well, I hope that this program is not going to stress you out some more, and we can take deep breaths together.
I have been looking forward to it.
and relax. I want to dive straight into it and build up from the last talk that we had when I was happy you were a guest in that one, although it wasn't really your area of your profession. I know you're particularly a urologist. And for many people who don't know what a urologist does, you think of uro, it is to do with the urinary system, but the urinary system is very much connected to men's reproductive health, whereas a gynecologist will be focusing just on the women's health. So the urologist will handle issues, both women and men, when it comes to the urinary tract system, but particularly more with men's health. I hope I got it right over there, but this is what I understand. And when we were speaking a month ago, we were speaking about how stress affects the immune system. And I want to take off from there. And we spoke about the two different systems that we have in life of, the fight or flight mechanism, of the sympathetic system, which is really helping our survival. It's helping us stay alive. And so that is fight or flight. Either we're going to stand up and fight, or we're going to get the hell out of there. Or maybe there might be a moment of freezing. I can see I would be the one who would freeze because I'm not very good at running. And then the other, and it's kind of a switch. You're either on this fight or flight mechanism, or we are on the rest and digest, which is the parasympathetic system. And we're going to focus a lot on that and just look a little bit more in detail into these systems, the fight or flight stress system, and then the rest and digest system, just to understand a little bit of how it works. And then Dr. Mumba will break it down for us in terms of why stress is particularly bad for the reproductive system. I'm going to have a go at sharing my screen. This is all kind of a little bit of new technology, but let's go. Give me a thumbs up there, Mumba, if you're seeing this diagram over there on the screen. Yay, I did it. I did it. Right. So you will see on the right, we have the sympathetic nervous system. So this is the systems. So think of the nervous system as a communication network between the brain and the body. And basically the nervous system is a sensory system. We want to sense what's going on outside, and this information comes up to the brain, the main controlling system up there. That yellow thing at the top is the brain. And then the messages, after the information has come to the brain has to figure out, okay, what do we need to do about this situation, whether it's a dangerous situation or it's a calm system. And then the messages go down. So we are looking at the autonomous nervous system. So this, guys, is the nervous system that happens and we don't even know what's going on, right? We're not talking about the part of the nervous system that makes me lift up my hand or do something which is in our conscious control. These are the things which are happening under the radar. Otherwise, we wouldn't be able to manage. Can you imagine if you had to tell your heart, okay, now beat, okay, now breathe, okay, now this, we wouldn't be able to do anything else whatsoever. So this is the system that we have over here. So in the sympathetic system, our eyes, if we look at the diagram, our eyes are going to dilate because we're on red alert. We want to see what is happening. We are not going to be focusing on the digestive system, so we're not going to be having much saliva. So when you're panicking, you may notice that your mouth becomes dry. And we're all familiar of that feeling of the rapid heartbeat. When we get scared, the first thing that even tells us that we are scared is that our heart is beating. The air passages relax so that we can get as much air in, because the thing that really determines how much energy we have is the oxygen that we're taking in. We want really a lot of energy into that system. And our stomach is not going to be working because that's not an emergency right now. And even the things that are happening in the intestines. And we will see also that there's a lot of the secretion of the kidneys just above the adrenals. We're going to be excreting a lot of adrenaline and cortisol. And cortisol is going to be really what Dr. Mumba is going to talk about. Alternatively, when we are relaxed, we will, our pupils can relax, and the relaxation is they constrict. We can digest, our heart rate is going to go down. We can relax our breathing, our stomach can start working again. And also our reproductive system. It's not on this diagram, but this is our focus, and it's going to be in every part. On the parasympathetic system, we have more energy that's able to go to the reproductive system, whereas on the other one, we are not going to be going, the energy is not going to the reproductive system when we are panicking. So that's why when we're panicking, we're in the fight or flight system, we're not going to be able to digest our food properly. If we stay in the system, it affects our reproductive system and it affects our immune system. Okay, that's enough of the geek in me. I wanted to get this, ball rolling. I mean, some of you will have also known Mumba from the Stiletto Secrets that run in Lusaka from 2013 to 2015. Beautiful, intimate meetups with women, even though they were quite big. I'm sure and a lot of the time I know we were more than 50, but it had that intimate air. And you had a knack of breaking down these, complicated scientific concepts into everyday and actually interesting. It's like, wow, even hilarious sometimes. So going into our first topic of how stress is affecting the reproductive system. You said something, doctor, that was really interesting to me. You said that stress is a poison. Break that down for me. I find that really intriguing.
So we chat quite a bit, you and I, and I tend to say a lot of things. But I do particularly remember saying stress is a poison simply because it's true. I think at the basis of understanding how it all works, one needs to understand one of the fundamentals. So all the hormones and chemicals and substances in our body do have a role to play, okay? But when you have potent substances such as cortisol, those have a very specific role to play and should not stay in your body for too long, okay? It's kind of like salt. You just need enough to, salt your food, taste it. You don't then pour a whole bag of salt because that becomes inedible, okay? So that's how I like to explain the principle of cortisol. Cortisol is the hormone that basically you need it to do certain things, like wake up in the morning, okay? Just before you wake up, just before your waking up time, you get a boost in cortisol, and that kind of wakes you up and gets you ready to go, okay? You can't live off that ready to go, wake up, you know, you just need a little bit of it, okay? The other thing with cortisol is that it's produced in the fight or flight system. It's a stress hormone, okay? It's a hormone that's used to get your body in tone, get you ready for action, okay? This is good when you are in danger or when you're in a high stress situation. You're, you know, at work, you're in a situation that needs your not rest and digest system, because you should not be resting and digesting. You need to be moving. So it's good, okay? You need your adrenaline running in there. It's good for that purpose. It's not completely bad. The problem becomes when you sustain these levels of stress, okay? Now, I must mention that anything that pushes your body into a you know, action mode or ready to move can be considered a stress. So that's very important to understand, that that can be considered a stressor. So you need to be very aware, which is what drew me to yoga, actually, to be aware, you know, to be aware of what's going on, okay? Because anything can be a stressor, and which is why I like to say stress is a poison, because you keep feeding yourself with stress, the stress hormones don't know that they need to regulate themselves. They just respond to the environment. So in the end, you find that you keep your levels of the stress hormones very high, and you're unable to do the things which you should be able to do in a non-stressed mode. You know, I hope that doesn't sound too complicated, okay? So you have your hormones, which do have a role to play, but if it's a sustained stress, it's constantly there, then they counteract all the other good things that you should be doing, okay? So you need the stress hormones as a spice, as a, you know, as a spike, but not as a constant supply of these very potent chemicals in your body. Because, you know, just about anything can be poison, like you mentioned, Towani. Just about anything can act as a poison if you have it in a high enough dose for a sustained period of time. So I think as we're going into a discussion, it's very important for us to understand that the different systems that are at play in our bodies do have a reason for being there, but it's important to not stay in that, you know, stressed mode. Okay, so I hope that was clear for everyone.
Yeah. Now, I want you to understand. Just I'm a bit confused about cortisol. Let me just be honest. Even though I know I've heard about it, but I kind of forget what it does. Could you break down what exactly is the cortisol doing in the body, and what is it stopping from happening? Because it seems that when one hormone or chemical is working in the body, it is affecting others from working on the body. So it's like one is doing this and it's stopping the others from doing that.
Cortisol is important, okay? It's produced in the adrenals, just above the kidneys. So it's important for certain functions, like I mentioned. A simple thing that you may not have been aware of: cortisol is what gets you up in the morning, for example.
Oh, okay. I wasn't listening.
Yeah, some people, like I didn't know for the longest time that cortisol is what gives you that, you know, rise and shine. Okay, it's a complex balance with other hormones, but it does something as simple as get you up in the morning. But you don't need a high dose of that. You just need to wake up in the morning. Okay, other things it does, like we said, it's one of the players in the fight or flight system. Now, when that's happening, it's busy saving your life and not looking at other functions such as digestion or reproduction. So whenever I do adult sex education, I do mention that what cortisol does is, when you're busy producing cortisol, you're not going to produce the love hormone. You're not going to produce enough of the feel-good hormone. You're not going to produce enough of the relaxing hormones. What does that do to you? What that simply means is that, oh, there we are. So what that simply means is that we're in a tense, what word can I use? Non-loving, non-loving kind of mode. And what does that mean? For the topic at hand, this simply means, for example, your love life suffers. As simple as that, because you're in a fight and flight, go mode. You're not in a, love, rest, digest. And what this does is that it's a vicious cycle, because you realize that even your other systems are not functioning well. So you generally have ill health. And when you have ill health, your reproductive system cannot function. Okay. So I like this chart that's on the screen right now. It basically explains what I'm trying to say. So we have other hormones in the body, like oxytocin, the love hormone. Its levels in the body are generally counted by our stress hormone. So when you're producing your stress hormone, you can't produce the love hormone, okay? So that then will have a very big effect on your libido. It will have a very big effect on your intimate relationships, your intimacy. And that's something that a lot of people don't actually know, and they wonder why things are just not working out, and they blame so many other things, not knowing that they themselves are poisoning themselves. Okay. Did I miss out anything? I think we talked about the dopamine, we talked about the endorphins. These are all things that work together, but unfortunately, they're countered by things like cortisol, adrenaline. So you really have to be very mindful of what you're allowing affect your internal environment.
Now that kind of leads us into, really biting this, just setting the scene. And now we can dive straight into the first area, which is sex issues. So you're a urologist, and I wanted to find out, what is the main or the most common, male sex related problem that you come across as a urologist?
Top of the list is erectile dysfunction. In fact, you'll find that diseases that seem to threaten erectile function will actually get patients into my office. So if a man thinks that, oh, I feel my tummy hurts, could this affect my my potency? You'll find that men will come in simply because it's very high on the male patient's concerns, and rightly so. So erectile dysfunction is top of the impotence. Erectile dysfunction and that complex is top of the range.
And in your experience, what are the main causes for this erectile dysfunction?
Erectile dysfunction is very complex, because like I always say this, it creates a vicious cycle. Okay, so you have the male partner failing to get a potent erection, right? That will then diminish his confidence. Okay, and what does that do? He starts to stress. Okay, he gets performance anxiety. He starts to stress about that. So he's, for example, going to bed stressed, waking up stressed, goes throughout the day with this stress buildup, and which will affect most of the rest of his day-to-day activities, and comes back home with the high levels of the cortisol that has been circulating in his body the whole day. And now it's time to get intimate, but guess what? It can't happen. Why? Because of the stress cycle, you see. So in the end, you find that it potentiates, it has that potentiation effect. So it potentiates, and so you find that it's very difficult to treat. Another cause can be organic, and we're seeing quite a rise in that. Organic means there is something actually wrong with the system. Okay, so the system could be from the brain all the way down. to the actual genitalia. So whenever we're seeing clients, we have to establish where along the system the problem is. So that's organic. And then a big percentage is psychological, which may feed back into home stresses, work stresses, economic stresses, etc., etc., etc.
Now, I have heard that for the male reproductive, well, for the reproductive system in both women and men, that the flow of blood is very important. Anything that affects the circulatory system can affect one's sex life. How could you shed a little bit more light on that?
Okay, so without sounding too sciencey and nerdy, several studies have actually shown that, in fact, even locally here in Zambia, that erectile dysfunction or erectile function can actually be used as a surrogate for cardiac health. And that in clients who were diagnosed with cardiac conditions, you find that erectile dysfunction precedes their cardiac diagnosis. So it's one of the first telltale signs. And why is this? It's very simple. The male genitalia, the male reproductive organs are basically sponges that rely on good blood supply. It's just spongy tissue. Actually looks like, I'm just looking at the pole here.
Yes.
So you find that it's critical that your cardiac health is intact in order for your reproductive health to be intact. So this also plays a similar role in women. It's all about flow. It's all about the flow. Once you get the blood flowing, you get the blood moving, then you know that you're getting good reproductive health. Just to add to that, in Zambia, I don't know if you've heard of this, there's a very I don't know what to call it, but there's always a fad that comes in, one fad or the other, that's talking about a woman being warm. I don't know if you've heard of this.
Yes.
It's all about women, and people will do all sorts. In fact, right now there's a huge fad that's going on with certain additives people are using just to make the woman warm. Now, what I like to say about this is, in our culture, I think it was a time at which there was not a lot of science going on. So when you do think about it, they did have a point that when a woman is warm, it signifies fertility and reproductive health. Why? Two reasons. When a woman is turned on and receptive, you find that a lot of blood is rushing to the genitals. Same thing with the man. And what does blood do? When blood goes to a system, or when blood goes to a center, it becomes warm. Something as simple as when you rubbed your hands together, you can try it. You rub your hands really fast, the blood vessels there start to dilate. She's trying it. Your blood vessels start to dilate. And if you do it fast enough and persistent enough, you find that the blood vessels are dilated and there's more blood going there and it gets warm. So that's where that comes from. Okay, so it's all about circulation. And even in our cultures, though they didn't know why they were saying that, it was about circulation. So it's there in a lot of other cultures as well. But I just thought it was interesting because you hear it colloquially, you hear it out there, people talking about a woman should be warm, this and that, but it's ultimately all about circulation.
So if somebody has a disease, has problems in the cardiac system, or blood pressure, or weak heart, then it will have an effect on their erectile function?
Yes. Yes.
Okay. It could be I think you mentioned this before earlier, that it's actually an early warning sign that something is
Yes.
wrong. Before it manifests
Yes.
in other areas, this can be some of the symptoms. And because, you know, the good thing is, because it affects the sexual functioning, you will find that your clients will come and they have an opportunity to look at some of their cardiac. They came because of something that was erectile functioning, but the solution is actually to see someone, a specialist in their cardiac area.
Cardiac, exactly. Exactly.
It's really a great system. I like what you said about bringing in the woman area, as you know, speaking about women and fertility, which leads us really onto the other one. I know we're not going to be able to cover all the topics. We're kind of really going into, you know, how stress, just touching on how stress affects some of these different areas. And I do know that for a woman that at the most fertile time in the cycle, and I'm just going to show a video of this most fertile time, but when a woman is on the most fertile time in ovulation, what we find, yeah, when we find in ovulation, what we find is that the temperature goes high, and that if you're monitoring your fertility, and if you take your temperature, that is one of the signs that you know, one has ovulated, is that the temperature. So I think, again, that was another aspect that I think our forefathers were right. But just to check this video of ovulation as we go into the next part of the discussion. So here we've got the ovum coming out, going down the fallopian tube, and then you'll find that the sperm meet the ovum in the fallopian tube over there. Fertilization in this case comes down, there's already multiplication happening. And then if this, you know, fertilized egg then embeds in the uterus over there. And this is really fertility. So the blue over here is the ovary. So for fertility, we're looking at it in terms of being fertile means to be able to produce viable eggs or ovums, and the hormonal balance to do that, to release the egg, and also to have these fallopian tubes clear. I do know that if these tubes are not clear, we have problems. And then for the male fertility, it's to produce enough of those sperm. You know, we're talking about being science geeks, Mumba. I was reading and preparing for this topic, and it was like 200 million sperm are produced. And out of those, something like only 400 make it out of the man, and only like 40 are going to make it. Only 40 are going to make it to the egg, and only one is going to fertilize the egg, you know? So I thought that was really, really, really incredible. And fertility is a very complicated thing. And I remember you were saying, and I know you specialize more with male fertility, but you know, being a doctor, you have a general overview of everything. Could you just, you know, speak about the balance of fertility? There is a common held view that fertility is really a woman's issue.
So I must say, early in my career, to my greatest shock, I discovered that a large percentage of fertility is actually dependent on the male factor. And in fact, with couples that are not succeeding in spontaneous pregnancies within 1 year of trying, we tend to divide the infertility, as it were, and try and diagnose whether it's female factor, male factor, or a combination. And it has been documented, depending on the literature and the region. In some regions, a third is attributed to male factor infertility. A third is attributed to female factor infertility. A third can be a combination. In some literature, it's as much as a 50-50. Okay, So it's actually takes two to tango. And so medicine is now, medicine and society, actually, medicine has always been there, but society is now moving towards trying to, you know, encourage the men folk to also take an active part in the fertility kind of discussion.
In what I know is that there's another percentage which is not explained. So if 1/3 is the woman and 1/3 is the man, and then 1/3 is a combination, that still leaves us sort of like with that 10% that we, you know, we're not really understanding what is happening. And I have experienced that with the yoga I have read, and I think in every year of the 10 11 years, you know, the 10 years that I've been teaching, 10 of those 11 years, every year I've had at least one female client who has actually been fairly young in my experience, late 20s, 30s, who hasn't been able to conceive, but, you know, for a year or more than a year. But in their cases, I noticed that within a year of doing yoga, sometimes even 1 month or a couple of months, every single one of my clients managed to conceive. One did go for in vitro fertilization, where the fertilization is done externally and then put into the womb. But before, she was rejecting these fertilized eggs. And then, so I really see that. I feel that the more we're having more stress, and the stress is what is, you know, causing the problems, and people are going to all sorts of ways to solve these problems. But I want to speak about some things that I heard just recently in terms of, you spoke about traditionally, you know, we understood the importance of warmth, that warmth meant that there was fertility. Could you share some of the traditional ways of coping with infertility?
I smile because of late I've really been delving into, you know, our historical. I've always been a fan. I've always been intrigued by our ancient ways. I was having a discussion with one of my elderly aunts and I think uncles, and they were just explaining how in some parts of, well, not now, but historically, if there was infertility in the family, you would find that if there was infertility in the family and it was noted that perhaps it was male factor infertility, a brother to the husband would then be, the wife would be taken to a brother, and the brother and the wife would actually conceive a child. And this child would look, you know, the family genes, it's basically the same gene pool. So this child would look, you know, would look kind of similar to the general family features. And I know we were laughing about it. It was said in a very light manner that, you know, these are the things that people used to do historically to preserve, you know, the community bond, the family bond. And I found that very interesting. And that way, that's how they used to cope with infertility then, before we knew about alternative methods, before we knew about male factor or female factor. So the male factor infertility was handled in that way, which I found quite interesting.
Yeah, so they had donors. They knew about male donors. They had a
They did know about surrogate mothers, you know, sperm donors. They knew. The theory was there.
Yes, the theory was there. Yeah, I have heard of cases where if a couple, you know, were not having a child, maybe someone who had someone else in the family within the bloodline, maybe who had too many children that they couldn't cope with, would say, here, take care of that body. I think that's really, really beautiful. Now, from your experience, how have you seen that stress is affecting the fertility? Are there any particular lifestyle aspects which are stressing our body?
Well,
and affecting,
you know, the basic thing with most things, cancer, infertility, biologically, our bodies don't like, certain levels of certain things in our body. Things like smoking, for example.
Mm-hmm.
We all know the don't smoke. Smoking is dangerous. But what it does in terms of at a very microscopic, level, at a very basic level, is
Mm-hmm.
that you introduce certain chemicals that are very potent, that have the ability to actually kill cells like sperm and ova, which are responsible for fertility. Yes. So you have oxygen-free radicals, which are very difficult to counter. So by doing, certain lifestyle choices, um, end up leading to an accumulation of certain substances in our bodies. A diet has been spoken about a lot. We do eat a lot of processed foods, a lot of foods with estrogens, a lot of food with a lot of things that, you know, so that's also always top on the list. Obesity, it's just the culprit for just
How?
about anything under the sun. Obesity, well, obesity leads to lifestyle diseases such as diabetes and hypertension. Okay. Diabetes and hypertension are the number one enemy to, and I speak for the male factor. They just cause they influence male potency. Okay, so if you're looking at diabetes, you're looking at diabetes effects on the circulation. Hypertension, same thing. So once your circulation is affected, there's really very little even we can do as medical doctors to reverse that. Some of these things are irreversible. Okay, so those are just a few of the things I can think of off the top of my head. And another thing that I think is important to mention is that stress itself, it's quite evident that stress has such a potent effect on our bodies. I think we spoke about this. Top athletes and people in the military. I have heard, I haven't read extensively, but I've heard that some go without getting periods. The female athletes, for example, some will go without getting periods simply not because they've changed anything, not because, but that stress is so intense that you find that their periods just stop. So our bodies are very sensitive they're very delicate. It's a very delicate system.
Yeah. I've experienced that with some of my clients as well. Even if, in the case of athletes, it's physical stress in terms of
Yes.
how much their bodies physically have to go through. So that physical stress led to no periods. But I have experienced it with a few clients where just the stresses of life, what's going through in them, they don't have periods. But once they came to yoga, and yoga helps change the pathways, then they're like, oh, now that I've started yoga, I'm regular again. And as long as they continued with class, they were regular again. Now, speaking of stress, it's a bit stressful looking at the screen. So let's take a yoga break. If people need to just stand up and stretch, we started about 10 minutes late. So, indulge us. We are, due to Towani's stressful technical challenges. So we've got another 20 minutes to go. But before we go, let's just release some of the stress. And the first stress we are having is with our eyes, just looking at these screens and these devices right now. So we're going to do some of the warm up that we do in the Katuta yoga classes. We're going to work our eyes, and we are going to move clockwise with our eyes. How big? Keep the head in place and move to the right. 1, 2, 3, 4, 5, 6, and change anti-clockwise. We want to be going 1, 2, 3, 4, 5, and 6. And now we want to close our eyes and rub our palms together. Remember what Mumba said about creating blood flow, where there's blood flow, there's heat. So we rub as hard and fast until we get some heat in the hands. And we're going to inhale and place those warm palms on our eyes. And exhale, push that warmth in to soothe the eyes. Inhale, draw tightly closed and cut fingers over the eyes. Exhale, open the eyes underneath the closed fingers. And inhale, open the eyes. And that's one way we can release the tension from our eyes, and we can take the hands off the face, because I can see Dr. Mumba is still holding her face. She
I was enjoying that.
Darkness, calmness, right? And another area, I don't know about you, it's really all about the neck as well. So first of all, inhale and sit nice and straight. And exhale, relax the shoulders. Without knowing it, sometimes the shoulders go up. I'm going to inhale, look to the right. Exhale to the left. Inhale, right. And exhale, left. One more time. Inhale and exhale. And inhale, lengthen up. And exhale, just tilt the head to the right side. And let the left shoulder hang. Inhale, we can take the chin a little bit forwards. I feel the stretch at the back of the neck a little. Exhale, I feel a little bit in the front. Oh, this feels good. Inhale, midway. Exhale, tilt. So sometimes just small things to de-stress us. Inhale, lengthen. Exhale, release the arm. And again, keep breathing through the nose. This also relaxing. Inhale, back. Exhale, forwards, and just hold it. Inhale, midway, and onto the shoulders. So in yoga, we try to breathe through the nose because that keeps us in the rest and digest calm system. When we breathe through the mouth, it kind of sends us to the panic system. So observe where we're breathing from. And just circle shoulders a little bit and forwards a little bit. And a nice stretch is to take one hand up the back, up there. You can see my fingers wiggling. And then other hand up, and just see if we can get them to touch, and change the other side. And then inhale, we're gonna lengthen. Exhale, just turn to the right. Wow, did you hear that click in my spine? Inhale, forwards, and exhale over to the other side. And just shake, just get the blood flowing. We talked about blood flow. Just get the blood flowing before we fall asleep. Great, we're ready to continue. And next, I think this is the one we've had the most questions on so far. Thank you very much for Namonje, who's asking. We'll come to Namonje's question right now. And so both questions we have are actually about menopause. And I think this is really, I have to admit, the stage of life that I'm fast heading to. Whether I like it or not, we have to accept that, you know, life is a journey. It's a boat that never stops still. You know, it's the cycle of life, and we need to honor all stages of our life and of our journey. So first up, let's speak about menopause. Now, sometimes I think we know what we're talking about when we're talking about menopause, but I'm gonna, you know, put up a diagram for, you know, Mumba to talk about, for Dr. Chalwe to talk about, in terms of what exactly is menopause. I kind of like this one because
I like it.
More interesting than the others I found.
I like this diagram. I really like this diagram. So, though I don't deal with women a lot, I do. What you need to remember is for menopause, andropause, it's all about the hormone levels. Okay, it's physiological changes in the body that are happening as a woman goes through these stages in her life. So I really like this graph. You have, if you can see on the upper axis, there's the estrogen level. And if you follow it carefully, you can see that between 0 to 35, it's more or less, you know, regular, you know, everything is as we know it, normal reproductive, you know, life. The first, yes, that first part. And then as you're heading towards 45, you can see that the levels of estrogen start to not drop, but to dwindle and to sort of fluctuate. That's the right word, fluctuate. There's ups and downs, dips, and as you can see, it's quite irregular if you follow that that graph. Irregular periods, weight gain, and all those things that worry a lot of women. They get very worried, especially in this age group, from as early as 36 to 45. In fact, menopause, it's something that is familial, where if there's a history of early menopause in one's family, then one should be quite aware of that. So it's very important to find out from the female side of your family at what age menopause occurs in the family, just for you to be able to predict and get an idea of what's happening. From about 50 onwards, most women are hitting menopause now, menopause proper, okay, where they have changes in the vaginal environment. The vagina starts to get a bit dry. There's changes in libido. In fact, though, around this time, because estrogen is really dipping, something I found very interesting I've always found it interesting, is that the testosterone levels, on the other hand, kind of remain more or less the same, because we all have testosterone, we all have estrogen. Men have estrogen, women have testosterone. We all have these hormones. They have important functions. And you find that as women are hitting menopause, some women really flourish in this time because their libido comes up because of that testosterone. Their libido shoots up, and now they don't have periods and pregnancy to stress them.
Oh,
so yes, you find that some people around this age become, the tigress, and I've had a few people that I have met who say, you know what, this is the best time of my life. I've never felt this free and, the self-awareness without the stress of tampons, for lack of a better. So it's an interesting part of a woman's journey. And then, of course, there's post-menopause with the attendant problems, the UTIs, the loss in bone mineral density. What I should mention is that a lot of these things, both in men and women, can actually be countered before you hit, the menopause and the post-menopause stage.
How?
Lifestyle changes, for example. If you're active in your 30s, you're healthier in your 30s, okay? You have less stress in your 30s. You're investing in your future, okay? Because, for example, I'll pick osteoporosis because it's quite common. You find that if you're relatively healthy earlier on, you're building up reserves for yourself. For when you hit the time when you don't have so much reserve and your hormones are dipping and your body is changing. So it's important for all of us to learn about this now and sort of invest in our futures.
I think this is a good time to ask Namonje's question with regards to menopause. Namonje asks whether stress can cause early menopause.
I actually think so, because there are many factors that cause early menopause. And as we've been discussing, the body is so sensitive. The body is a very delicate balance of chemicals, of, of substances. So I won't say definitively, but I think it could. It could lead to, changes and lead to things happening earlier than they should. So
Yeah.
I would say, based on the science and the science alone, I would say yes. But of course, like all other things in medicine, there are no definitive yeses and definitive nos.
It's a combination of factors, but I do.
Combination of factors.
Reading, and I remember in our discussion, we spoke about how I think cancer, the whole chemotherapy, is so stressful to the body that it causes menopause to happen. Menopause being that, one stops menstruating, one has not menstruated for more than a year. And women who go through chemotherapy, even if it's in their 30s, could go through menopause because the stress of the chemo will induce menopause. And people who drink a lot of alcohol or are into drugs may have early menopause. But I think even if it doesn't bring it earlier, what I have seen is that it causes, what can I say, more adverse symptoms. That's a better way.
The intensity.
Yes, yes. I think that the stress, even if it doesn't cause the menopause to come earlier, it can, the stress, whether that stress is on a physical level with mental stress, or in a physical level with the chemicals, whether it's medication or alcohol or smoking. Smoking is another one. They make it difficult for the body, and then it's a rough ride basically. Then if you are looking after yourself, that you're exercising, that you are eating right, with that's my interpretation. I don't know if I'm
like I said, it's about investing in your future. So you invest in the good stuff, keep your hormone levels balanced, keep your the basic things, cholesterol levels balanced, your blood pressure balanced. These things all play such a big role in the future you.
Yeah. I will say yoga has been very helpful with that in the menopause area, in that there's a whole category of poses which help menopause. Many of them are the inversions. They help because this, as the diagram that the Dr. Chalwe went through, it's all about the hormones. And a lot of the craziness is like in puberty. The hormones are, going up and down in puberty a little bit before they, become a little bit done. And then they go up and down. So I find that there are so many poses in yoga that help regulate the poses. I think I'm definitely in perimenopause right now. In a couple of the periods of, like, now it's 2 months, now it's 2 weeks. It's a little bit crazy. The other 2 months, about a month ago, I was like, oh my gosh, I think this is a hot flush. And I did inversions. I just did inversions. And I tell you, Mumba, as long as I was doing inversions, I didn't have any hot flushes.
I can believe that. I mean, you look 20, Towani. You've looked 20 since I've known you.
So I know it really helps. And what you was talking about, the blood flow as well, the poses that help with period issues, the poses that help with when one's menstruating and menopause, are the poses that open up the pelvic area and allow a lot of blood to come in, and and it makes sense now when you spoke about really the reproductive system is all about, getting this flow, right? Fresh nutrients in, get the bad stuff out, and nerves as well to regulate the whole thing. Now we have got almost about 5 minutes left, and I wanted to find out, people to speak of menopause, and it seems to be a change that is just about us women. And I kind of, growing up, I thought that us women, we get a raw deal. We got to deal with periods, and then we have to deal with menopause. What did the guys got to go through? Is there an equivalent for guys?
Yes, actually. The male physiology, I believe, is just not spoken about enough. I don't know why, but you do find a correlate. Okay, there is a natural dip in testosterone level in men, which happens early 40s, late 30s. It's a very small dip, but for some men, they actually do feel, it's enough for them to feel an actual, there we are, to feel an actual change. So from the puberty levels of, really, really high, you find mid 30s, there's a sharp decline. You can see it. It's quite steep, actually. And some men can actually perceive that. And that's where we have our, midlife crisis. I make jokes about it, the Ferrari buying midlife crisis that some men go through. Then interesting, after at about the late 40s to 50s, and yes, and after the 60s, there is a sharp decline. And this is known as andropause, where the testosterone drops significantly. And in fact, some men do get hot flashes. Like if you deprive the testosterone all the way down, you get men with hot flashes. You get a decrease in libido, fatigue, lethargy, and general unwellness. So although their fertility is not affected, a man is still potent unto the grave. The testosterone dipping does lead to erectile dysfunction, impotence, and sometimes a syndrome known as ADAM, that is androgen deprivation of the aging male. And that we have to actively treat, because some men go into clinical depression that needs actual treatment. Wow. So yes, so it's quite serious, and it makes up quite a bulk of my work as well. So it's not a one-sided seesaw. Mm-hmm. It's both spectrums, both ends of the spectrum.
Mm-hmm. And does that, I know, like for women with menopause, there is this hormone replacement therapy to help with the fluctuations. There's some added hormones, you know, between estrogen and progesterone. There's different researches as to whether just estrogen, just progesterone, or both. For andropause, I guess it would be supplementary testosterone. Would I be wrong?
Yes, but the urology community, the jury is still out, because we are that's about the same age we're battling with prostate cancer, right, which is a testosterone dependent cancer. So there's that kind of, yes, so it has to be under proper care. It is done once you're cleared. We do have ways of boosting, you know, trying to boost that and
right. Otherwise, you increase the testosterone, and then testosterone means higher chances of prostate cancer. Gosh, it's the body. It's all.
Yeah.
It's a balance. It's a balance.
It is.
What are the lifestyle things that men can do? I mean, as they're going into, you know, to andropause, have loss of motivation, the muscles goes down, there's loss of libido. What can be done? What lifestyle changes can help?
Number one, if you're in your 30s, you're male, start running, start exercising, have your natural testosterone keep you through this time so that you have enough to last you, make it a habit, okay? Number two, high consumption of alcohol leads to more obesity, and more, not necessarily obesity, but the abdominal fat. Okay. And with abdominal fat, yes, with abdominal fat, you're converting all your testosterone into estrogen.
Hang on. When you have fat, the male hormone is converted to a woman's hormone.
Yes.
Testosterone is converted into estrogen.
In fat cells.
Wow. So does that explain why men who are carry more weight or more obese, are a little bit more effeminate, have man boobs? Is that part of the reason?
Some people have suggested that the man boobs, as they're called colloquially, may be due to that. Maybe due to that. So the obesity, especially abdominal fat, is a big thing. And just a simple thing as reducing the amount of alcohol intake, controlling your cholesterol, controlling how much visceral fat you have, can make a huge difference, even for erectile function, for impotence. That's one of the first things I tell patients: lose some weight, as simple as that.
Wait, so with just that, with these lifestyle changes of exercising, so eating well, staying away from alcohol, smoking, or reducing at least significantly the alcohol. losing weight, we're gonna get better on better sex life, better fertility, and better transition through whether it's menopause or andropause. And I think it's never too late. I think if already one has gained weight, especially as women, we gain slowly, whether men as women, and then we now, especially with COVID, if we are now sitting and working from home, we can start and slowly, just don't let it get worse. So I think it's not about beating ourselves up about, what has happened. We can't change what has happened. But for me, especially for yoga, we're really focused about this moment. And you remember, Mumba, our rule number 2 is positive attitude, no judgment. Right?
Judging.
We just go forward. I could talk to you for another hour or more, but I gotta contain myself because we are I'm honoring your time, my time, and everyone's time. And I really just wanted to thank you so much. And just think about making those lifestyle changes with regards eating so that we don't put on so much weight, moderating to stopping the drinking, stopping the smoking, and exercising. Yoga is a great exercise to do. If you have a teacher near you, join. If you'd like to join Kututa Yoga, you will see on the Facebook page how you can join the physical classes in Kabulonga. You could also join online classes with me on Monday, Wednesday, and Friday. But I really hope you enjoyed this and you learned something. Please do share this recording. Start a watch party. I will share the recording and with people, with our loved ones who we feel that we could benefit from that. So, in yoga, we have a way of saying bye-bye, which I forgot to say in the beginning because I was so nervous. But I can see Mumba's already got her hands together. That's the way we do it. So it just means namaste. It just means the divine in me salutes the divine in you. We are honoring the preciousness of life in ourselves and with everyone else. And all this is about taking care of our life so that we can really live a fulfilled life and helping the other people around us do the same. Namaste. Thank you very much, everybody.